Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Susan Hill. You are the supervisor for the Care Provider Training Program at MAC Incorporated, and you're here to talk about this exciting new program. So welcome, Susan.
Thank you very much. I appreciate being here today.
I know you're very excited to talk about this. It doesn't start till January, but you wanted to get the word out about this program. It's a federally funded program.
That's correct.
But tell us what it's focused on.
So we're focusing on caregivers, those individuals that maybe need additional training in Alzheimer's and dementia. We're also going to be working with individuals that may want to go further with their education, to work in a nursing facility or an assisted living, but really focusing on gaining some skills and knowledge of Alzheimer's and dementia. We're going to be having CPR and first aid, medication awareness, and also falls prevention. And then we've built in an on-the-job training. So during the class, the individuals will be able to do some work experience on-the-job training within MAC in our Connection program, which is our adult daycare program, and also in our Life Bridges, which is our Alzheimer's and dementia program.
Well, I know, and of course everyone knows, how we need more people working in the senior area, which includes long-term care, assisted living. But this is for care providers initially to be companions, correct? And companions are different than a certified nursing assistant.
Correct. We're not a certified program. We're not doing a certification. However, there are individuals, as you know, that really want to remain in their homes. And so they want to have somebody come in their home and help them throughout the day, providing them some companionship, and just giving some respite to the other family members that maybe are not able to be there during the daytime. And they can do this. They can either do it through private sitting on their own, or they could do it through a home health agency or home care agency.
Yeah, very good. That's a very important service because, as we know, many people do want to stay in home as long as possible. And particularly if you have Alzheimer's or dementia, it's important that people stay at home as long as they can. Exactly. And respite, of course, for the family.
Exactly.
So you mentioned they train on basic skills related to Alzheimer's and dementia care specifically. And you mentioned falls prevention.
That's correct.
Understanding the medications and how to help with those medications, and communication strategies, of course, are important with Alzheimer's patients.
Definitely. So how to deal with maybe a difficult situation, how to identify a behavior, and how to communicate not only with the individual but also with the family of an occurrence that may have happened during the day. To be very effective in assisting both the family members and the individual that they're providing care with.
So the primary goal here is to bolster the workforce.
Exactly.
Of companions that are specifically trained to work with people with Alzheimer's.
Exactly.
Well, that's wonderful. So tell us a little more about the actual training itself. It's a 5-week program.
Training's for 5 weeks. It's Monday through Thursday, a couple of hours a day. And like I said, it's not just basic training in a classroom. We're going to be doing work experience. We're going to have guest speakers come in. We have somebody from DDA that will be coming in and talking about working with individuals with disability as well. The main focus is Alzheimer's and dementia, but we're expanding this to anybody that wants to provide care in somebody's home or an assisted living, whether it's private or working through an agency.
Well, very good. And I know the on-the-job training can occur right there at MAC, as you mentioned,
Exactly.
with the adult daycare and the Life Bridges, which
Yes.
is a newer program for people with Alzheimer's to come there for daycare specifically.
Correct. Individuals will have between 7 and 8 days. Will they be working with the Connections program and the Life Bridges program, working with those individuals, gaining some experience, to gain some knowledge of how to use what they're doing in the classroom, working with those individuals.
So this should definitely help with that problem.
Yes.
Now, does this mean that someone that completes your program and they become a companion and they can provide those types of services, that I guess the good news is if they're interested in that and find that's their calling, then they can move on? You have a way to move them on to, say, certified nursing assistant?
We're very fortunate this grant has some supportive services and some customer incentives. So if somebody's interested in additional training, we have the funding for them. We also can refer them out to Warwick. We can refer them to Lower Shore Workforce Alliance, Title Health for additional training for CNA, and if they want to go on for further other additional trainings.
Well, that sounds just fabulous, because we know, especially here on the shore, there is a need for companions and CNAs, and it sounds like a wonderful program. I appreciate you coming in to talk about it, and what we'll do is at the end of the program we'll post MAC Inc.'s website, although it's still under development as far as this program goes, because it's so new.
Right.
But we'll give people your name and number if they're interested in the companion training.
That would be great. I appreciate your time.
Well, thank you for being here.
Thank you very much.
Joining me now in the studio is Tracy Wainwright, job developer for the Care Provider Training Program. Welcome, Tracy.
Thank you for having me.
Now, you're another important person in this Care Provider Training Program. You're the job developer, so what exactly is your role?
My role is to try to help the participants match up with employment, hopefully upon completion of the training, as far as finding a job with either a facility, a home health care facility, or if they are going to be looking to be a private sitter. I also work with the actual facilities, trying to see what their needs are as far as employees are concerned.
So when you say facilities, are you referring to assisted living facilities?
Yes, assisted living or home health care agencies on that end of it.
Right, they get requests from perhaps people in the home
Right.
with Alzheimer's, and the family decides they may need a companion to stay with their loved one.
Yes. Yeah, they help facilitate matching up a provider, a healthcare provider, with a family or an individual that needs some assistance.
So you also have a bit of a coaching role, don't you? Not just finding them placement, but some coaching?
Right. So one of the things that I hope to be doing during this training is working with the participants individually as far as finding out what kind of experience they have, what they are looking to do, and try to match them up with appropriate employment. I help them with barrier removal. I also refer as far as if they would interested in additional training to other agencies that could help with that. Title Health or Warwick or the Lower Shore Workforce Alliance has a CNA program. So if they're interested in doing that beyond our training, I can facilitate, getting them connected with those agencies.
It sounds like just a wonderful stepping stone to get someone interested in healthcare and care of people with Alzheimer's, and then some of them may move up into the CNA world and elsewhere.
Right, exactly. So a basic stepping stone, the first step, entry level as far as healthcare is concerned.
So again, they're getting trained in how to be with someone with Alzheimer's, understanding what the disease is, their medications, fall prevention, communication strategies, and then hopefully they take it to the next level if they find they enjoy that kind of work.
Yes, absolutely, because we definitely have a need for care providers out here, especially on the lower shore. So.
Oh, great. Well, it sounds like just a wonderful program. So if someone is interested in this companion training program, how do they get signed up?
Well, you can give us a call. Call Susan Hill at MAC at 410-742-0505, and it is extension 147. And we can get them the information. And currently we are sending out applications through the mail. We hope to have registration online in the future. And for our classes that begin in January, the application deadline is November 28th.
Well, that's just excellent information, and with a deadline, and hopefully you'll get a very brisk response.
We hope so too.
We'll put information at the end with regards to the website and then who to call if someone's interested in this training program, which sounds like it's a great asset for the Eastern Shore.
Yep, thank you so much.
Well, thank you so much, Tracy, for joining us about this very important program.
Thank you for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.